Come in.
So sorry. Hello there. My name is Wendy. I'm going to be your nurse for today. How are you doing today?
Good, how are you?
I'm good. I'm just going to wash my hands with some hand sanitizer. Would you please verify your name and date of birth for me?
Haiti Velasquez, 92690.
Awesome. Katie, are there any known allergies that I need to know about today? No? Okay. And do you know why you're here at the hospital today?
I'm sick.
You're feeling sick?
Mm-hmm.
Okay. Do you know what day it is today?
July 2nd.
July 2nd? What year is it?
2019.
Okay. So what I'm going to do today, Haiti, is I'm going to do a head-to-toe assessment. And then after that, I'm going to go ahead and check your vital signs, make sure that everything is okay before we get started. Your treatment today. So first, I'm going to go ahead and check your head. I'm just going to be checking to make sure there are no bumps. It's nice and clean, no dandruff, no lice. Very good. Okay. I'm checking your ears, making sure there's no abnormalities, there's no drainage. Okay, can you look this way? Looks good. Okay. Katie, can you go ahead and smile for me? Okay, no signs of drooping. The temperature feels good. You're not flushed, you're not pale. Okay, so I have this light pen here. What I want you to do is look straight ahead. I'm going to shine the light into your eye, and I'm just checking for pupil dilation. Make sure that you're reactive to the light, okay? Very good. Good. Okay. Now what I want you to do is follow my pen light, okay? Keep your head straight. No, keep your head straight. And don't move your head, just move your eyes. Very good. Okay, Amy, now I'm just going to take a look and make sure there's no redness, there's no irritation. Do you wear any contacts or reading glasses at home? Okay. And those are doing good for you? You're not? Okay. I'm going to take a look inside your nose. Make sure there's no drainage. It looks like you have some irritation inside of your nose. Do you have allergies?
I think so.
Okay. You need to take a look at that, okay? Do you have any difficulty swallowing? Okay. Can you open your mouth for me and say ah? Checking your tonsils, checking inside your mouth for any cuts, any kind of irritation in your gums. Your lips don't look dry. Can you swallow for me? Okay, good. So now what I'm going to do is I'm going to go ahead and check your lymph nodes. Check for swelling. No swelling. Great. Now I'm going to check your carotid artery. Can you go ahead and look that way? Here you go. This way. Okay. I'm going to check your trachea, make sure that it's midline with your body. Okay, everything looks good. Okay, so now what I'm going to do is I'm going to assess your upper body. I want you to push up against my hands. Very good, very strong. Okay, can you do this? Can you lift up? Put it back down. Stretch arm out to the side. Bring it back. Bend your elbows. Very good. Was that painful at all for you? No? Okay. I'm just checking for any signs of bruising, any irritation on your skin. Nothing, no cuts. Okay. So I'm going to go ahead and pinch your fingers. I'm checking for capillary reflex. Okay. I'm going to check your radial pulse. Can you make sure you're doing that? Thank you. Just making sure that they're both there. There are no deficits. Yeah, got both. Let's check to see if you're hydrated. You are hydrated. Okay. So now what I'm going to do is I'm going to go ahead and take a look into your heart and your lungs. Do you think you'll be able to kind of scoot a little bit over here so you can sit at the edge of the bed? That's good. I'm just going to look down your shirt, make sure there are no scars, no bruising, nothing unusual. So we're going to start with the aortic valve. Pulmonic valve. Now this one is called Erb's point. Tricuspid. And the mitral valve. Very good. Do you have a history of smoking, chewing tobacco? Okay. Do you have a history of using any oxygen at home for any therapies? Okay. Now I'm going to take a listen to your lungs. So, just going to ask you to take a deep breath. Again. 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 Okay. Sound clear? No signs of crackles or wheezing, so that's good. Now I'm going to have you stay sitting up like this. I'm just going to be assessing your back, making sure that there are no bruises, no cuts, no ulcers around your coccyx area. Everything looks good. And again, I'm going to have you take a deep breath in and out, okay? You're going to do that 8 times. Okay. No signs of crackles. So I'm just going to adjust the bed a little bit because I need you to lay down for me. So go ahead and scoot back into the middle of the bed. And lay completely flat. Is that painful at all? Okay. So Haiti, what I'm going to do next is I'm going to assess your abdomen. I'm just going to lift up your shirt. I'm going to check, make sure there's no distension. Make sure there's no abscess or any kind of lumps or bumps on your tummy. Now I have a couple of questions. Do you feel nauseous today? No vomiting? Okay. And you've had a bowel movement today? Okay. I'm going to take a listen, starting from the right lower quadrant. Now when bowel sounds are present, you listen for 1 minute, okay? Okay. No hypo sounds and no hyper sounds. I do hear sounds though. Sounds are present. Now I'm going to percuss. Now you're going to feel a little pressure here. Let me know if you feel any pain. I'm just palpating and making sure there's no unusual. Okay. Now I'm going to check your perineal area. When you go to the bathroom, do you feel any pain? Is your urine dark or clear? Clear. It's clear, okay. No blood in your urine? Okay. You wipe front to back. You're pretty clean. Okay. Looks good. Okay. Do you want to stay laying down or do you want to sit up?
Down is fine.
Down is fine. Okay. Now I'm going to take a look at your legs, okay? I'm going to ask you to do some range of motion, which means pretty much bending your leg, your knee, all the way to your hip area. I want to make sure that you have good range of motion around your hips and your thighs. Go ahead and bend your knee. There you go. Is that painful at all?
No.
Okay. You want to lift it up for me? Okay. No pain? Okay. There's no bruising, no redness in your calves. Temperature is good. No swelling. Okay. Now, Haiti, what I want to do is I want to ask you if you can just press against my foot. Push against it. Okay. Forward. Great. Make sure your heels are good. No sign of pressure. I'm going to check your pulse on your feet. Making sure that they are both equally palpating. Good. Okay. Now I'm going to check the capillary reflex. We have good blood return on your feet. And you are not dehydrated. Great. Now, Haiti, I have a couple of questions for you in regards to walking. You're able to get out of bed and walk around without any assistance? Mm-hmm. You don't need any, like, assistive devices, walker, canes, nothing like that? Okay. So you're good to go to the bathroom? Okay. Regardless, just always still call us. Here's your call light. Always ring the bell. That way we can help you get out of bed. Never get out of bed by yourself. Do you have any concerns about being here at the hospital? Do you feel safe? Mm-hmm. Okay. Do you feel safe at home? Okay. And one last question. Do you feel like hurting yourself?
No.
Or hurting others? No. Okay. Let me make sure that the bed is completely locked. Okay, it is. And your call light is here. Your bedroll is up. Okay. So let me go ahead and chart my assessment, and then I'll be right back to do your vital signs. Wash my hands, and I'm charting all this stuff. Come in. Okay, Haley, I'm back. We're gonna go ahead and do your vital signs now. I'm gonna put a pair of gloves on. Would you please be able to sit up for me? Let me get another pillow for you. Now, Haiti, just want to make sure that I check your identification. Can you say your name and date of birth again for me?
Haiti Velasquez, 9/26/90.
Okay. And again, no allergies. Do you have any pain today? No pain? Okay. So I'm going to go ahead and start by taking your pulse. There you go. I'm going to count this for 1 minute, okay? Okay, Haiti, that was great. Your pulse is 76. Okay. Now what I want to do is I'm just going to put your hand over your chest here and just go ahead and relax while I take your temperature, okay? Can you see it out? Close your mouth. Okay, respiration is 16. Your temperature is normal, 98.6. I'm going to go ahead and check your blood pressure. We're going to do it on this one, okay? I'm going to locate your brachial pulse. Okay. Go ahead and relax your arm, okay? Okay. 115/80. Now I'm going to check your oxygen saturation. Perfect, 98%. That's great. All right, so I have a couple of questions in regards to your pain. You said that you weren't feeling too good. You came in today because you felt a little under the weather. Is that what you said? Mm-hmm. And you don't have any pain at all?
Um,
Are you having any pain?
no physical pain, no.
Okay, so you're in because you have a sore throat. So is there pain in your throat?
Not in this moment.
Just say
Yes.
okay. And what causes the pain? Is it
Swallowing.
swallowing causes the pain? Okay. And does anything make you feel better or make it feel worse?
Warm drinks makes it
Warm
better.
drinks makes it better.
Mm-hmm.
Okay. And if I were to ask you when the pain started, would you be able to tell me that?
About 2 weeks ago.
About 2 weeks ago. Okay. That sounds severe. Would you be able to tell me the pain level between 1 to 10?
It was about a 7, but now I'm not having as much pain as
Okay. And does it stay only in your throat, or does it radiate to any other particular areas, maybe inside your mouth, like behind by your ears?
Just throat.
Just your throat. Okay. So we're gonna go ahead and get these results into the chart. Your doctor's gonna take a look at it, and then he'll be able to see if he prescribes anything for the pain on your throat. In the meantime, I can bring you something warm to drink. If you need anything, here's your call light. Just let us know. Make sure your bed is locked. Are you comfortable right now? Okay. If you need anything, just let us know. Thank you, Katie. I'm gonna wash my hands, and I'm done.